This specimen is a cross-section and longitudinal section of a complete peripheral nerve. And one of the first things that you need to realize is that there's a difference between a nerve fiber and then a collection of nerve fibers which is organized into a nerve. And nerves in the body have names like the median nerve, the ulnar nerve, the femoral nerve. In gross anatomy, one learns the names of these nerves, but we're looking at the histology, and here the long profile is a longitudinal section of a peripheral nerve, and over here is a cross section. So let's take a look at the longitudinal section first. Well, no, I'm going to go back on that. Let's look at the cross section first. So what we have here are three fascicles. Here's a large fascicle, a small, and two smaller ones. Now, a fascicle is composed of a collection of nerve fibers that are bound together with a connective tissue wrapping. And the connective tissue wrapping here is the perineurum, not the perimysium. So a perineurum wraps one connective tissue fascicle, and here are the collagen component and the modified fibroblasts that really are connected with tight junctions to seal off this peripheral nerve from the surrounding tissue. And each one of these little dark diamonds marks the inside of a peripheral nerve. And if you look over here, this is the actual axis cylinder within the nerve fiber, and these little dark basophilic areas. And then the halo of the lightly staining ring around that, that's where the myelin was. And in the normal tissue processing using alcohol, the myelin was dissolved away, which is mostly fat. And so in this specimen, you can it's very difficult to see the endoneurium, which would be connective tissue surrounding each one of these. You'd have to do some artificial enlargement, in which case you're just not going to be able to see that in this specimen. Up here, it may be a little bit better if we enlarge this, say this area here. You can begin to see some connective tissue that lies between, and these some of the flat cells would be fibroblasts, and most of these cells would be Schwann cells, because the Schwann cell is the cell that makes the myelin that wraps the axis cylinder or the axon of each of these nerve fibers. And so this pink area here would be the endoneurium. Okay, and out here's an arteriole, which you're not studying yet, but you will soon. But you are studying smooth muscle, so there's 2 or 3 layers of smooth muscle cells around this arteriole. And a couple of other small fascicles here. Some of these nerve fibers are cut in cross section, and others are kind of in a longitudinal section. And again, if I enlarge this area slightly, you can see the nerve fibers and some of the nuclei fibroblasts or of Schwann cells. And out here, you've already studied this, is adipose tissue. And now if we look at the longitudinal section, here you see the axon, the dark basophilic wiggly structure that's going through several of these nerve fibers. And then around that is the myelin. If I enlarge this slightly, you see it more clearly. Here is the axis cylinder, or you might call it the axon, with the light area around it, which is where the myelin would have been. Same thing up here. Okay, so and then of course you have connective tissue wrapping, the endomysium, and then on the outside you've got the perimysium. Okay, I think that should be enough, along with the annotations, should be able to understand this specimen.